Acute lymphoblastic leukemia, also known as acute lymphocytic leukemia, is a type of cancer that affects the white blood cells, specifically the lymphocytes. It is characterized by the rapid proliferation of abnormal, immature lymphocytes, which are a type of white blood cell produced in the bone marrow. Here are some key points about acute lymphoblastic leukemia. Classification: all is classified based on the type of lymphocyte affected. B cell all, which accounts for the majority of cases, and T cell all. These subtypes have different characteristics and may require different treatment approaches. Symptoms: the symptoms of all can vary but often include fatigue, weakness, pale skin, fever, easy bruising or bleeding, frequent infections, bone or joint pain, swollen lymph nodes, and abdominal discomfort or swelling. Causes: the exact cause of all is not well understood, but it is thought to result from genetic mutations that disrupt the normal development of lymphocytes in the bone marrow. Certain genetic and environmental factors may increase the risk of developing all, including exposure to ionizing radiation, certain genetic syndromes, and certain infections. Diagnosis: diagnosis of all usually involves a combination of blood tests, bone marrow aspiration and biopsy, imaging studies such as X-rays or CT scans, and other tests to determine the extent of the disease and its specific characteristics. Treatment: treatment for all typically involves chemotherapy, which uses drugs to kill cancer cells or stop them from growing and dividing. Depending on the subtype of all and other factors such as age and overall health, other treatments such as targeted therapy, radiation therapy, stem cell transplantation, or immunotherapy may also be used. Prognosis: the prognosis for all varies depending on factors such as age, subtype of all, response to treatment, and the presence of certain genetic abnormalities. Overall, advances in treatment have led to improved outcomes for many patients with all, particularly children and young adults. Follow-up care: after completing treatment, patients with all require regular follow-up care to monitor for any signs of recurrence or long-term side effects of treatment. This may include blood tests, bone marrow examinations, and imaging studies. It's essential for individuals with symptoms suggestive of all to seek prompt medical evaluation and diagnosis to initiate appropriate treatment as soon as possible. Early diagnosis and treatment can improve outcomes and increase the chances of a successful recovery.